how it
would
started.
like to share with you the journey of the heart surgery that we had by one of the best surgeons in India, Dr. Pavan Kumar. I especially want to mention the fact that he's extremely good and we had a very comfortable journey, I should say, because usually we are very afraid, whenever we hear that we have heart problems or we have to go in for a surgery. The first thing is we are very scared. Now my husband, he had a major problem. He works in the C.
Which was been caught by Nitin.
Yes, so we have our cardiologist is Dr. Nitin Gokhale. So he used to get palpitations and fast breathing usually, and because he has a very strenuous job, he's working in the sea and all, he's in the shipping line. So what happened was we went to Dr. Nitin Gokhale and he heard a murmur in his heart and he immediately said, okay, there is something. That was in 2022, 2 years back. After that he did the various tests, 2D echo and protocol, whatever is the usual this thing. They did all the tests and everything, and it came out that his
we have to go for a surgery,
highly damaged, and he has to go in for a surgery.
Which I avoided at that time. Remember, I avoided. I said no, I don't go for surgery because
he was keeping on
someone.
avoiding because usually we think like this ना कि नहीं ठीक हो जाएगा, दवाई से ठीक हो जाएगा, something like that, which doesn't happen actually. So ultimately we did the last year, that was in 2024, he was getting so breathless that he could not walk, so we did the angiography, and in the angiography we came to know that he had a 99% blockage as well, and Dr. Nitin Gokhale, he suggested that Dr. Pavan Kumar is the best. If you are getting it done, you only get it done by him. So immediately we came to Leelavati hospital and we admitted him. And in the angio...
The very first time I met Dr. Pavan Kumar, like he straight away took us like in his hands. We were totally in a comfort zone. Like we are very, because before that I was very scared. No, I don't want surgery. I don't want surgery. Yeah. Very first moment, I still remember he just got me like that because he was making him comfortable and making me comfortable because I'll be going in his hands.
Yeah,
he has to look after me. So that was very comfortable.
When we did the surgery, when doctor later on told us he had 99% blockage, there was a valve replacement which had to be done. At the same time, he had a stone in his heart, which is something which is very
This we came to know later on.
During the surgery, and his surgery was very complicated, like it lasted for 9 hours or so. But still, when he came out of it on the second, third day, he was walking.
No.
And after 1 week,
before putting the valve, there was too much confusion. Should we put tissue valve or should we go mechanical? No, both of us, we were totally unaware of both the valves.
Because we
didn't know what.
Know what is what. So many people may suggest that tissue is very good, and it is very good. But the only problem is the surgery has to be repeated after 10 years. Now we chose the mechanical valve because in the mechanical it's for lifetime. The biggest thing is that we just have to take a few precautions, take the medication which is there for every disease, I should say, or any problem that you have. So that is the only thing. Otherwise it lasts really well, and like you can see him after 1 week he was perfectly he was getting much better, and by after 1 month and all we were like coming to the doctor and we were going around. In fact, we were partying after 1 month, I should say. So it has been a very smooth and a very comfortable journey, and it has taken out a lot of fears and a lot of misconceptions that people may have regarding a valve replacement, and mechanical valve is actually quite good and very helpful. So that is all that I can say. I would suggest like we have been
Do you want to say something, Mr. Kaushal?
Main thing now also, I don't want to go any other cardiologist
and he's
because
going back to the ship.
One more thing, I'm going back to the ship, but even then I have so much of confidence in our doctor because now I don't want to go anywhere else because he knows my inside.
Yes.
Inside, outside, he knows everything. Okay, what is there,
So
what
our
is not there.
favorite is Dr. Pavan Kumar and
Yeah.
Dr. Nitin Gokhale.
Yeah.
Yeah.
Thank you.
Thank you very much, Mr. Kaushal and Mrs. Shabnam ji. Such a kind words for me, and it is definitely so encouraging. Here is a most lovable, beautiful couple, and so understanding they are. And it is always pleasure to help them out. And I did my best to give him. It was a complex surgery involving coronary artery bypass surgery for his coronary artery blocks and mitral valve leakage. Unfortunately, leakages are not associated with any clot formation, but in his case there was almost a stone-like clot sitting in the left atrium, the chamber which gives blood to the left ventricle. So we have to remove that stone like clot and replace the valve along with the coronary artery bypass surgery. Then it was very important to discuss, as always I have discussed with the patients, what kind of valve should be of your choice, whether it is a mechanical valve we should use or we should use tissue valves. Because these are the two valves available to us. Tissue valves have their own advantages and their drawbacks, and mechanical valves have their. So it is important for us to share the information and knowledge to the patient. As he is very intelligent person and is young, so ultimately all of us decided, me and Dr. Gokhale and the patient, with the consent that we use mechanical valve. I have used mechanical valves over last now 33 years or so, and my long-term results with the mechanical valves are beyond 25 years. Patients come to me yearly or 6 monthly. They maintain their anticoagulation very well. They have to just take one tablet to keep their blood thinness. That's it, and it is not very complicated and not much medications, and then they can lead a normal life, which you are seeing here. He has gained weight, he walks around, he parties, and now he's back to his ship work. So I'm glad to share this story. This is a story which should be made available to all patients, those who require a valve replacement surgery, that how beautiful valve surgery replacement results are and how the recovery is so great. Thank you very much.